This segment is sponsored by Golden Triangle Internal Medicine and Geriatrics.
Hey, Southeast Texas, thank you for joining me for another edition of Ask the Doc. This is Dr. Levine of Golden Triangle Internal Medicine and Geriatrics. Happy New Year. We do have one question for today. It's the new year and I'm trying to diet but having some problems with control. Do you have any advice? Well, that's the big issue, how to push away and not eat as much as we want to eat. Unfortunately, our society is set up and geared to eat frequently throughout the day. And man, it is very tough to go against those sort of enticements to eat and drink all day long. A lot of the foods that we consume are very high calorie or calorie dense. And so we have to work on that as well, just because our society is inundated with a lot of sugar, a lot of starch, especially in the beverages that we consume, such as juice. Some of the coffee beverages that we consume has a lot of sugar. So even though you think you're not eating or drinking a lot, these items are packed dense with calories, and we're sitting a little bit too much throughout the day. So a lot of times when you're trying to lose weight and get healthy, you first have to start with your diet and get a lot of that sugar and starch out of your diet. And certainly you have to combine that with a routine exercise program. A lot of us are sitting down at work and we need to get up and be a little bit more active at work. Certainly if it's about control, there are some appetite suppressants, which is probably what I would recommend to all of you. There's about 4 or 5 on the market. They tend to be a little bit expensive, and unfortunately the insurance companies have not yet bought into refilling those and paying for those, so it tends to a lot of times come out of your pocket and be very expensive. But certainly those medicines are effective. I use them every day and I've had a lot of success, so talk with your primary care doctor about that.